Hey guys, Miss Hunter here, and we are going over Unit 5 today, Medication Administration. It will be important that you review Chapter 35 in your textbook that goes along with the content in this unit, as well as please watch the Unit 5 skills videos that go along with this content as well. As always, we have your learning objectives here, and remember these are the takeaways you should have from this lecture along with the other associated videos. So let's get started talking about the medication order. So this is given by the provider and it tells us what we are supposed to give to our patients. So it's for a specific patient, not for multiple ones, but for one specific patient. And it'll tell us what drug is to be given, as well as the dosage, so how much, the form, so is it a capsule, a tablet, is it a liquid, what is it, what form of the drug is it coming in? The time for or the frequency of administration. So does it need to be given right now? Is it after meals? Is it given twice a day? Those kinds of details. And then the route. So is it oral? Is it rectal? Is it intravenous? Intramuscular? How are we giving this patient? How is it entering the body? You'll see here this example is listed. Metoprolol is a drug for blood pressure. 50 milligrams is our dosage. PO is by mouth, so we know it's going to be given orally. And then BID, which is the time and frequency here. We don't actually have the form of the drug, but most likely since it is oral, it'll be a capsule or a tablet. So a prescription, different than the patient order or the doctor's order, that will be in the clinic. The prescription is what is given and sent to the pharmacy for the pharmacist to fill for the patient to go home with. There are 8 parts to the prescription, and I want y'all to make sure that you know these different 8 parts. There may be a question on your quiz about the parts. So this first part, of course, all of the information from the physician, so knowing where this prescription came from, as well as all of the information for the patient, so making sure that we have the right person with this drug. The superscription, this is the symbol RX. That's the RX, and it kind of shows us that, hey, this is going to be the recipe for this drug. The inscription, this states the names and the quantity. So these are our ingredients, right? If it's different medications mixed together, that's our ingredients to our recipe. The subscription, this gives directions to the pharmacist, so anything that they need to know as far as how to fill this prescription. The signature, or SIG, S-I-G, actually gives directions for the patient. Don't let this trip you up. The signature of the SIG gives directions to the patient. So if they need to eat something beforehand, or don't drink anything or eat anything at all while taking the medication, what have you, these are the directions for the patient. Then there's the physician's signature, and then any other information as far as refills or anything like that after that. So here you'll see an example of our 8 parts. Remember all of our doctor's information, our patient's information, that superscription, our inscription, our ingredients here. The subscription, that's going to be telling the pharmacist what to do. Our SIG, any of those directions for the patient, that doctor's signature, and then any special instructions or refills listed below. Here are just a few other example prescriptions. E-prescribing, I did just want to note that most prescriptions are now e-prescribed, so all of this prescription information will be electronically handled, and it actually does reduce a lot of medication errors. Here I have given you many abbreviations that are used with prescriptions. It is going to be very important for you guys to review these and be familiar with them, as well as the next slide, which will show us abbreviations not to use. So be sure to look back in your book. These tables are listed there, as well as in your PowerPoint presentation. So be sure to look at these. And note that these abbreviations that you cannot use are very, very important to avoid, because they do often get confused with other things that can be a misinterpretation and cause a medication error. So let's talk about dosages of drugs. So this, remember, is the amount of medicine that is prescribed. So it's determined by the physician, and they have to think about certain factors as far as how much of a medicine they're giving. So age becomes a factor. we're talking about adults here, so 16 to however old, 100 and something year olds, right? So there is a difference in how much we want to give someone based on their age. As you get older, your kidneys don't break things down as well, so that for those older adults, they may not be given quite as much as far as a dosage. As far as weight goes, most dosages are like a normal dosage is based on a person weighing about 150 pounds. So if you know, or the physician knows that their patient weighs much less than this or much more than this, they may have to adjust that dosage amount. Now, sex becomes a factor depending on if you're female or male. For females, you often have to think, is this patient pregnant? You know, are they lactating, meaning they're breastfeeding? You know, those become important factors when thinking about dosage and just if the drug is appropriate at all. And then other factors, so thinking through, do these patients have certain conditions that would require a different dosage amount? Pediatrics. So our pediatric patients are a little bit different here. And remember, we're talking about those under the age of 16. So when we're talking about drug dosage for these pediatric populations, they are based on weight. So dosages are often calculated in milligrams, micrograms, or milliequivalents per kilogram. So this allows for much safer drug administration. And more often than not, pediatric patients are getting much smaller doses, but they may be more frequent in nature. Okay, so let's move on to the medication label itself. So let's think through when we get a prescription bottle, what's going to be listed there. So oftentimes it has two different names, so either that trade or brand name, but also that generic name. Then the National Drug Code numbers, which identifies where that medication actually came from, the product, and the size of the container. So that code or specific numbers that identify this information. The dosage, so how much is going to be in that medication. The route of administration, remember we've talked about that. Any precautions or warnings. You know, some medications that may make you sleepy will say avoid any heavy machinery or driving while taking this medication. And then, of course, the expiration date, which is very important to make sure that our patients are following. Here is an example of that drug label, so you can note that all of that information that I just discussed is listed here. Calculating medication dosages. So the preparation and administration of medications is one of the most important tasks that we'll perform as medical assistants. If you incorrectly calculate or measure the dosage, it can lead to an error in medication administration. So it's so important to understand how medication dosages are calculated, as well as understanding how to draw up and administer medications properly. There is a medication dosage calculation worksheet on eCourseWare for you guys to fill out. It is not for a grade, but I highly recommend you guys practicing through those examples. And we do have some here in the PowerPoint as well, just for you to look at. So to understand medication dosages calculations, it's important to know what we are measuring and what we are using to calculate those. So we use the metric system as well as the household system, but more often than not, when we're actually in the clinic, we'll be using the metric system. So these include meters, liters, and grams, right? If you'll go back to some of your math or science classes and using those. But then sometimes you'll be discussing these dosages with patients using household measurements. So a lot of over-the-counter drugs that go home with patients are actually measured in teaspoons, tablespoons, or ounces, because this is how patients can measure those items out there. So calculating adult dosages. There are two measures for weight and volume that are used to determine the amount of medication that is administered. So for weight, it's often expressed as milliequivalents, micrograms, milligrams, grams, or units. And as for volume, we may use milliliters, drams, ounces, or any of those household measurements that we talked about, like teaspoons or tablespoons. So here we have a pretty simple example of a calculation dosages. The provider orders 250 milligrams of cephalexin, PO now. So we go to find the bottle of cephalexin in the drug cabinet, and it holds capsules that contain 250 milligrams. So we know by looking at this, We have a bottle with 250 milligram capsules, and the doctor has ordered 250 milligrams. So we'll give 1 capsule to our patient. Here's where it's not so simple. So the provider orders 0.2 grams of Equinol tabs. The dose on hand is 400 milligrams. What do you think we are going to do, guys? I'm going to give you all just a little bit of time to think through this. So 0.2 grams of Equinol tabs, and the dose on hand, we have 400 milligram tablets in our medication cabinet. So what we're going to do is change the 0.2 grams to milligrams. So that's going to make it 200 milligrams. So the provider has actually ordered 200 milligrams of Equinol tabs. We have 400 milligram tablets on hand, which means we will then have to divide up our tablet, so split it in half, so that our Equinol tab equals 200 milligrams. So we have to have the medication ordered and the one on hand in the same unit of measurement. So that's where it's important to learn how to calculate these dosages and work with those units of measurements that we have. All right, so calculating children's dosages, we talked about how these are based on weight, and there are 2 different methods used to calculate children's dosages. One is according to kilograms of body weight. So usually this one is the method of choice. It's a little bit easier to calculate. And remember, when we're converting kilograms to pounds and vice versa, it's 2.2 pounds in 1 kilogram. Another method that is used is what is called a BSA, or a body surface area. This is an exact method that is used to calculate a children's dosage. But here I've given you an example of how we can use a child's body weight to give a specific dosage. So the provider orders valproic acid 15 milligrams per kilograms per day to be given to Sally, who weighs 110 pounds. So what we do here first is we need to convert the pounds to kilograms. So 110 pounds divided by 2.2 is what? 50. So 50 kilograms. Then we have to calculate our dosage per day. So we have 15 milligrams times 15 kilograms, which equals 750 milligrams per day. Okay, is everybody still with me? So 15 times 50 is 750 milligrams a day. But this medication is to be given in 3 divided doses. So we have 750 milligrams that needs divided by 3. So for each dose, or each time we give the medication, we're only going to give Sally 250 milligrams per dose, because she's getting it 3 times a day. So then that valproic acid becomes 250 milligrams 3 times per day to equal that 750 milligrams per day. All right, so moving past our dosages, but also kind of thinking back still on that safety of our medication administration, just some guidelines that we need to follow. Remember to always wash your hands before and after med administration. We want to have a well-lit area. We're going to follow those 6 rights of drug administration that we've talked about previously, but we'll also talk about again here in just a bit. We're going to make sure that we check all allergies, right? Make sure they're not allergic to the medications. Give only the drugs that the doctor has ordered. Never give a medicine if you question anything about the order, if there's anything you don't understand. If you're not familiar with the drug, always ask questions or look it up. Make sure it's not expired. Never give a medicine that looks like it's altered in any way. If it appears wet or damaged, do not give it. When in doubt, throw it out. Double check the provider's orders. You're always going to be checking your EHR, your electronic health record, if you have that, or as well as your paper record. Give only meds that you have prepared. So do not allow someone else to get your medicines and then you give them, because you don't know if they did it correctly, if they've actually gotten the right medications for you. And then once prepared, do not leave any medication unattended. And I'm going to stop here and we will pick this back up in our second Unit 5 video.